Hi everybody, my name is Dr. Caleb Stott. I am one of the owners at Smile Now Dentures and Implants. We're a full service implant and denture center. We focus on patient care, patient needs. Recently I've come across quite a few forums where people are able to post questions that they have. And so this segment is dedicated to reading some of their questions and providing answers and expertise and insight into my experience with implants and dentures, having been doing this for nearly a decade. I seem to be getting air, water passing between my gums and from my top all-on-5 implants. It makes talking difficult. Has anyone ever had this happen? I think the swelling has gone down a bit since they placed the permanent ones about 10 days ago. Is this normal or should I contact my dentist? So this is a really good question. First, anybody that's going through these procedures where they receive implants and they're getting dentures fixed to them, they're gonna have moments of healing, and these periods of healing actually can last a really long time. What I mean by a really long time is not just like a day or two, but rather it can last months. When you have teeth removed, when you have your tissues removed to expose the bone so you can like smooth it and do the kind of work associated with getting these types of teeth, what will happen is the dentist or the surgeon will then reapproximate that tissue and suture it closed. During that time, the body responds with an inflammatory response, meaning that there's lots of swelling. It sends a lot of blood flow to the area to try to fight off bacteria, to try to fight off the different things that are going on and heal the site. And then what happens is we put on the set of teeth, which I call healing teeth or transitional teeth. This set of teeth closely resembles a really nice set of teeth. They look great. However, they're made as a transitional set of teeth because of the type of healing that's gonna happen over the next 2 to 3 months. So during that 2 to 3 months, quite a few things happen, like I alluded to. One of them is osseointegration of the implants, where the bone cells will actually fuse to the surface of the medical grade titanium that we place as part of our implants. After that happens, also the tissue is gonna mature and it's gonna change and kind of like toughen up. And that process is what's needed to be able to protect the implants and the underlying bone for longevity of what just happened. And so when this patient is saying, you know, I put on this set of teeth after my surgery, all those things that I just explained happen, and now I'm getting air or water that is like seeping or flowing underneath them. So this is especially true when people have a gap in the upper teeth. Usually they don't notice it as much on the lower teeth, but the upper ones for sure. And that's because part of the way that we speak, our conversations, even our breathing, the upper arch is more prone to having air escape through it between the tissues and between the new teeth. And then also water can seep in or seep through it. When this happens, it's really uncomfortable. People notice it right away. Sometimes people blow bubbles. Sometimes people have whistling or slurring when they talk. And what it really is the tissue's healed. And when the tissue's healed, they shrink a little bit and they matured. And so now there's a gap that exists between the new set of teeth and that material in your natural gums. So what do you have to do about this? Well, this is why at Smile Now Dentures and Implants, we're not a big fan of doing what some clinics do, where they do immediate zirconia teeth right after surgery. So when I say zirconia, I'm talking about the final teeth, the ones that they're gonna have for a really long time afterwards or even a lifetime. This material is really, really great for final teeth. However, because of the changes in bone, because of the changes in tissues, to get those immediately can cause problems where you have these gaps, and then you're gonna have to go back where you get refitted for a new set of teeth to be able to close these gaps, keep that air from escaping through it, keep, you know, water from flowing through it. So to this poster, the swelling went down after they placed the permanent ones 10 days ago, right? Exactly. And because of that, you're starting to have these gaps. I mean, it's either that or maybe the teeth, they loosened up a little bit and it created a little bit of a gap, which is also an easy fix. That means that you would just retighten the screws. It would probably create that seal again, and then you wouldn't have any of these issues. So those would be the two things that I would think about if I was thinking about this question and how to answer it. Okay, another question that we're getting from online is, hi, I had 4 implants done 4 years ago. Yesterday, I went to have my teeth cleaned and the dentist said I'm losing bone around my implants. What can I do? I'm so worried about this. When you pay money to have something done and you spend a lot of time and energy doing it, and then you come to find out later on that not necessarily that it wasn't done right, but that something isn't going perfectly the way that you expected to, then yeah, that would be very worrisome. So I can see where this poster is concerned about that. The situation with implants, so implants are a medical device. They're made out of titanium. Sometimes they're made out of zirconia. Although we do not use zirconia implants for full mouth rehabilitations. Usually Usually it's just like an individual tooth replacement option. When this happens though, like you place it into the bone, and the bone is an organ. It's part of your living body yourself. Bone is not the same as when you were born, is the same as when you were 10, the same as when you were 20. Bone remodels and reforms. There's little cells that eat away bone, and there's little cells that redeposit bone into the right spot. This is what healthy bone does. Healthy bone is always turning over and transitioning. How does that relate to implants? Well, the bone is turning over. You place the implant stays in the same place all the time. And so what can happen is you might have a little bit of bone loss. So a little bit of bone loss is acceptable, especially when it's not a lot. And we're talking about like 0.1 millimeters. So itty bitty. If you moved your fingers together into the smallest space possible that you could see between them, it's gonna be even smaller than that. That's considered healthy in the world of implantology. What is concerning is if you're having more bone loss than that. And we know today that when you have a lot of bone loss around implants, that's usually associated with tissues around it not being as thick or as stable as it needs to be to keep bacteria out and to keep issues from arising around implants. So we're always concerned not just about implants, not just about bone, but also the tissue around them. And if you are having bone loss, some will not affect the way that the implant and the tooth on top of it function. It won't be something that can be noticed, but it could be something that could be measured on an x-ray. And if there was a little bit, that's acceptable. But if there's a lot bit, you got to figure out why that's happening, what's going on with it, how to stop that process. And I would say too that whenever you have a lot of bone loss, it is an inflammatory response from something that's going on where your body is trying to fight something that it sees as a foreign invader. And through that process, you also have bone loss. And so those situations, you got to stop them if you want that implant to survive. So in this situation, yeah, you're worried and I get it. It may be nothing. Sometimes dentists say something and they don't really mean it to be critical. It's just an observation and it's not something that you should really be concerned about. But at the same time, we should be careful with how we talk about stuff because we can say the smallest little thing and then in your mind it turns into a bigger thing. What's always possible is you can get a second opinion. You can even post x-rays. And if you want questions that I look at specifically and answer this in this type of format or directly to you, I'm happy to look at anybody's case online to be able to help them understand what's going on with themselves because it's important to me that everyone gets good information that helps them with their journey of health. I hope this has been really helpful. If you have any specific questions that you want answered, I would love to answer those in this format. If you want to post those below and like this video, we would love that. What we're looking to do is just help people here at Smile Now Dentures and Implants on your journey to better health, to a clean slate, to be able to have confidence in the way that you interact in public. And hopefully this is just a small part of that journey for you. And we'll talk to you later.